Hello, everyone, and welcome to my rebroadcast of this webinar. Thank you for being here. I'm Dr. Knox, where in this webinar you are going to learn about the top 10 things that cause back pain of all time. And with that said, let's get started. So if you're just joining us, my name is Dr. Knox, and in this webinar you're going to learn about the top 10 causes of back pain of all time and how a chiropractor can help. Please remember, in this webinar, at any time you can ask your question or make a comment during any slide. I answer all of them, I promise. Let's get started. So, who am I and why should you listen to me? And what about my promise, right? Well, my name is Dr. Knox. I'm a Logan University graduate of chiropractic. I got my Doctor of Chiropractic in December 2004. Which means I've been practicing for about 15 years. I have a lot of experience. I've seen a lot of things in my years in practice. My promise to you is that by the end of this webinar, you will know exactly what to do and you'll have actionable information that you can use to take the next step, especially if you have back pain. Because as you'll find out, there are a lot of things that cause back pain. Something benign and simple that's non-threatening, or as bad as something deadly as cancer. And as this webinar continues, you will discover. So I'm board certified and licensed in a handful of jurisdictions here in the United States, in the state of Michigan, here in the Commonwealth of the Bahamas, the Health Professions Council, and through the Medical Board in the Eastern Caribbean of St. Kitts and Nevis. This is me volunteering my service, chiropractic care, spinal injury rehabilitation, physical exams for athletes, particularly track and soccer. I'm really passionate about this because I'm an athlete myself. I'm a runner, so I donate my services to athletes. And this is me doing my favorite sport, which is golf, right there in Anguilla on a beautiful Sunday. So, what is chiropractic? Because a lot of people really don't know, other than it's somebody cracking somebody's back. But the truth is, it's more to it than that. Chiropractic is the art, philosophy, and science of non-surgically correcting spinal misalignments by hand that cause neck pain and back pain. So we non-surgically correct spinal misalignments by hand, not by surgery, that cause neck pain and back pain. That's because insurance companies love us because we save them money and we save our patients grief from going through surgery. Okay? But how do we do that? Well, we do that when patients come in. The first thing a chiropractor will do, just like this chiropractor here, will take an X-ray. Chiropractors are heavily trained in radiographic positioning or X-ray positioning, and therefore we take our own X-rays, typically. Okay, if the chiropractor doesn't have an X-ray unit in his office, he will send the patient out where the patient can get the X-ray at a hospital per se. Okay, but in this case, this patient came in. She's complaining of neck pain, so he's taking a picture of her neck. So when she came in with her neck pain, tingling and numbness in the hands, shoulder pain, headaches, tension headaches, right? This is what was causing it. Her neck had completely straightened out. We call this a military neck. It's not supposed to look like this. It's supposed to have a natural curve like this. But this is what chiropractic care achieved after about 20 treatments. Okay? But how did we do that? Well, through chiropractic adjustments, by correcting misalignments in the neck, right? Through using a traction device for the neck to reestablish the curve. This is usually homework for the patient while they're out of the office. The patient would also do special exercise to strengthen certain weak muscles of the neck to help reestablish the curve, and then also a special orthopedic pillow, memory foam that has a special curve to help reestablish the curve of the neck. All of these things coming together to help reestablish the curve in this female patient. And now her neck pain, her tingling and numbness in her hands, her shoulder pain, her headaches are gone. Back pain. This is the number one presentation in a chiropractor's office where the patient comes in, and in this case we didn't do an x-ray, we did an MRI, and we can see the disc that's bulging, pressing up against these nerves, literally getting on this patient's nerves. In this case, we do a chiropractic realignment, a chiropractic adjustment in the area, right? Along with a healthy, balanced diet, vitamins and supplements, special exercises equals well-being, and we can turn this patient around, particularly in some cases where they'll need a little weight loss, and then their back pain will go away. So here's a short list of medical conditions that cause back pain, because sometimes it's not always straightforward. Strain, sprain, or pinched nerve. Sometimes it can be a little bit more serious. And by all means, at any time, in any slide, please comment below. I do answer all of them. So here's a short list of sources of back pain. Arthritis, fracture causes back pain, whiplash, where a driver gets hit from behind, and they have severe neck pain. Scoliosis, an irregular curve of the spine. We usually see this in teenage girls. Emotional back pain. This one's special. We're going to get into this one. This is usually when somebody hates their job and they get back pain without no trauma. Okay? Kidney stones causes back pain. Bulging disc or pinched nerve, that causes back pain. Prostate cancer. That's right. Prostate cancer causes back pain in men. Uterine fibroids causes back pain in women. Multiple myeloma cancer. This causes severe back pain, as you will see. And then the last one here, abdominal aortic aneurysm via high blood pressure. This causes severe back pain. So let's go ahead and look at each one now, and you'll see how each one of these cause back pain. Here's an example of prostate cancer. Okay, this is a normal hip, pelvis, and low backbone with normal color distribution. And I emphasize normal color distribution of the bone. Here's when cancer has left the prostate and spread to bone. And it shows up with these white spots that you see everywhere, in the hips on both sides, in the pelvis, and in the low backbone. So this male that came in complaining of back pain that he thought he got from working out in the garden lifting was actually from prostate cancer that had spread to his hip and low back. He went to a chiropractor took the x-ray, and this is what we discovered, and we immediately referred him to an oncologist, which was early detection and eventually saved his life. So here's an example of a chiropractor doing a good job of detecting something early that's related to back pain. And this is why chiropractic is so important, and you can't blow off back pain. Here's an example of multiple myeloma cancer. In this case, this is a side view x-ray that we took, and we can see blown out, punched out lesions like Swiss cheese, because this cancer is actually eating the bone. Okay, it's eating the bone, and these backbones are very brittle, and this patient was out in the garden lifting and bending, and she heard a pop, and that was because one of these backbones had collapsed in on itself like the World Trade Center and caused severe back pain. And she came in, and this is what we discovered, and then we immediately referred her to an oncologist. Okay, so here's an example of a patient coming in with one thing and we end up finding another. Abdominal aortic aneurysm via high blood pressure. Here's a side view of the spine, and in this case, you're not supposed to see the main artery that comes down that lays in front of the spinal column. You're not supposed to see it on X-ray, but in this case, we actually do with the trained eye. You probably can't see that from here, but with years of experience and in radiology, the trained eye can see that this tube that's carrying blood is kind of like blown out, narrow here, swollen here, because it's getting ready to rupture and tear because of the high blood pressure. And every time the heart beats, this blood vessel will bang against the sharp edge of these spinal bones here, causing pain. So it's very, very painful. When we discover this, this is a medical emergency. This patient has to be referred out to a vascular surgeon to save their life, because if this artery ruptures from banging against the sharp edge of the spine, that can be a disaster. Here's an example of somebody coming in with back pain, and when we take the picture, in this case it's a scan, we can see kidney stones, because when kidney stones break off and start to move down, they're usually sharp, and that's very painful. And these people come in with back pain, and this is a perfect example of something that's not a sprain or strain or pinched nerve, but they're in a lot of pain, and a chiropractor will refer this patient to a kidney specialist or a urologist to get this solved right away. This is the number one reason why patients come to see chiropractors: a bulging disc or sciatica, a pinched nerve. Here we can see the backbones from this MRI, and this disc is normal, that one's normal, and then this one right here is actually bulging out. It's herniated. It's pressing up against these nerves, literally getting on this patient's nerves. This is very painful, and this is the chiropractic specialty right here. We turn these patients around somewhere between 3 to 5 visits, more or less, and they can get back to their normal activities of daily living. Emotional back pain. We know emotions cause stress. Stress can cause headaches, stress can cause ulcers, stress can cause back pain, stress can cause high blood pressure, and the number one source for back pain is stress. Someone who hates their job. We call this emotional back pain. And they get this severe back pain not from an injury, but from their thoughts. And we see this all the time. Here's an example of scoliosis, an irregular curve of the spine. We usually see this in females, and they come in and we measure the spine angle, and we determine if they need bracing or surgery. And in many cases, this causes a lot of pain because of the angulation and the heart being compressed in this area. And we usually do this in high school screenings. Chiropractors are famous worldwide for doing high school screenings on teenage girls that have this problem, so that we can catch it early and give them bracing or chiropractic care, or both. This is an example of somebody with weak bones, osteoporosis. We usually see this in maybe white females, Asian or Indians that have osteoporosis or brittle bones, and they're doing something in the house or bending or lifting, and the bone completely collapses in on itself. This is a compression fracture. So this female will come in thinking that she has a strain, sprain, or maybe a pinched nerve, when the truth is she has a brittle backbone that has fractured and compressed on itself. This is excruciating pain. She needs to be referred to an orthopedic surgeon right away. Another area where chiropractors are very popular in is whiplash, where somebody gets hit in a car from behind, and they end up damaging the neck bones, the soft tissues of the neck bones. It's difficult to swallow. It's difficult to look left or right, and this is very, very painful. And chiropractors are known to create good results and recovery in these cases. Here's a case of arthritis where we have an x-ray of the low back, and each one of these bones have normal space where the disc is that's filled with water that absorbs shock, except this one. This one has no space. It's just sitting right on top of the tailbone, bone on bone. This is very painful. This is arthritis, and this causes very, a lot of pain. These patients are usually on strong painkillers just to get them through the day, and they usually end up needing surgery. And finally, uterine fibroids. Everything is normal in this x-ray except the fact that there's this big ball that's not supposed to be there, and that is a huge fibroid the size of a golf ball that's pressing up on critical nerves that lead back to the tailbone and low back. So therefore, it's referring pain to the tailbone and low back. So she came in thinking, she had a normal back pain from sprain, when the truth is it was pain referral from her fibroid. We referred her to a gynecologist. She got it removed, and her back pain went away. So, in the beginning, I made a promise to you that by the end of this webinar, you would know exactly what to do next and have actionable information about all these things: arthritis, fracture, whiplash, uterine fibroids, and something as terrible as prostate cancer. You know exactly what to do. And that exactly what to do is get on a phone and call a back specialist, someone that knows what they're doing, that could do analysis of your spine, take x-rays if needed, and to get you back in order so that you can have back your health, so that you could do the activities of daily living that you normally do, painless, without pain. So with that said, please, if you think that this webinar was helpful, by all means, make an appointment. You can add me here. This is my WhatsApp line. You could send me some questions or issues. And by all means, please comment right now below on Facebook or YouTube. Wherever you're watching this video, I answer all of them. And you can go ahead and add me, make an appointment. There's limited spaces. I'm only one person, and for the whole island, actually. But I love what I do, and I'll try my best to get you back better. And my name's Dr. Knox, and I hope this webinar was useful for you. If you have any questions or concerns or issues, please comment below. Once again, thank you so much for being here. I know your time is valuable, and I'll see you next time.